Obamacare is rolling along. In fact, across the country, we've got states that are saying, in every single case controlled by Republicans, saying, no, we really don't want to take the Medicaid expansion money. We would rather leave hundreds of thousands of our citizens totally uninsured and totally without access to health care. To hell with them. We're going to try and make the president look bad. Well, the Republican mayor of Belhaven, North Carolina, has said enough is enough, broken with his party, and stood with Reverend Barber, who's been a guest on this program many times, and said this yesterday.
If you don't have critical access hospitals, people needlessly die. That's a fact. We're talking about life or death here. People will die. This is not debatable. Nobody can come out here and debate if people are going to die or not. It is a certainty.
So with us is David Hartberg. He is a healthcare policy analyst with the National Center for Public Policy Research, conservative think tank over at nationalcenter.org. David, welcome back to the program.
Thanks for having me.
So why do you want people to die?
Well, you'd have to talk to the man upstairs. I don't have any real control over it.
But you're opposing a public policy that will give health care to health insurance to roughly 5 million people who currently don't have it. And according to Harvard University, that's going to save at least 17,000 lives this year if the Republican states were to simply take the money that's being offered to them. And in addition to that, it would create hundreds of thousands of jobs across the country. Why are you opposed to that?
Well, I'm opposed to it because, for starters, that Harvard study is simply wrong. They extrapolated it from another study that examined Medicaid expansion in 3 states, and that study found that only one of those states did the expansion have any effect on mortality. And even that study had problems because it left out a lot of individual factors that are related to mortality and might explain the finding in that one state. Basically, the Harvard study is on very shaky ground.
So let me get this straight.
The Oregon study, for example, found really no health benefits, no improvement in mortality for expanding Medicaid. And this is a very expensive way. I mean, we're talking about over the next 10 years, $690 billion for Medicaid expansion for a program where you just really don't get much bang for the buck.
Well, as you well know, the Oregon study demonstrated that a lot of people, very poor people, who were eligible for Medicaid, A, didn't know that they were eligible, B, even if they signed up, didn't realize that they could then walk into any doctor's office and they were still using the ER. What it demonstrated is that we need to associate some money to educate people along with the money that's being put out to provide care for them. And Oregon's numbers now have changed. I mean, it's been 2 years, and they've changed substantially. But are you really trying to come on this program and sell us on the idea that if 500,000 people who currently don't have health insurance and their only option is the law that Ronald Reagan advocated for and passed in 1986, that an ER cannot turn you away, their only option to get health care is to show up in the emergency room where they will be turned away if they're not in an acute crisis. So if they find a lump in their breast or on their testicle, or they have a pain in their stomach or whatever, and they show up at the hospital's going to say, come back when you're actually bleeding. You're coming here to tell us that having access to a primary care physician, to preventative care, to an annual a checkup and exam at no cost, that is not going to save lives?
I'm coming here to tell you that Medicare doesn't really give you that much access.
This is Medicaid.
Medicaid does not give you that much access to a primary care physician. I mean,
it gives you an annual free physical.
Across the country, 69% of physicians are not seeing new Medicaid patients. In North Carolina,
across the country,
the number's 24%.
Well, wait a second. You've got
the worst form of insurance for actually being able to see a doctor.
You've got about a third of the doctors in the United States who don't take money from insurance companies, David.
In fact, researchers at the Journal for the American Medical Association found out that you're more likely to be able to visit a doctor if you're uninsured than if you had Medicaid.
I was unable, here in Washington, D.C., and I've got very good health insurance, I was unable to find a doctor, a primary care physician, who could see me within a year who takes health insurance. So the doctor that I have does not take health insurance. Mm-hmm. Period. I mean, it's concierge medicine. You pay in advance.
Sure.
And it's growing. because the doctors are fed up with the health insurance companies. You've got, by some estimates, 20 or 30% of doctors who not only don't take Medicaid or Medicare, they also don't take health insurance money.
Oh, I agree with that, but then what good is expanding Medicaid going to do for that?
Well, we need more doctors, obviously. We need to stop the AMA from limiting the number of people who can graduate from medical school. I mean, as a start.
I would actually agree with you on that, and I would also say that I think we should have a system where primary care doctors don't take most types of insurance. Primary care, I think, is relatively cheap, and all you're doing with an insurance system is putting more costs in terms of paperwork on.
And I think that we need to expand the number of people who can offer primary care to physicians' assistants and RNs and nurse practitioners.
I think we should probably look into expanding that as well.
But all of those people can be reimbursed by Medicaid. So once again, the question: why deny access to Medicaid to 5 million people just to make the president look bad? I mean, why do you want people to die just for politics? I don't get this. This seems to me a horrible moral failure.
No, I think it's a matter of not extending false hope to people. I mean, you're putting people on Medicaid with the promise that they're going to get access to health care,
and they do,
and then they don't get access to health care.
But they do.
They don't.
They may not be able to go to this doctor because they don't. Just like with me with a Blue Cross policy, I can't go to. I literally could not find a doctor in Washington D.C. who would take me. Yeah, I mean, there are barriers to getting into the healthcare system in the United States, but that doesn't mean that you say to people, I'm sorry, we're going to refuse to pay your medical bills if you get sick. That seems un-American. Are you telling me that if somebody shows up in the ER and their breast cancer has reached the point where it's separating, where it's breaking through and literally we've had ER physicians on this program describing people who lack any access to health insurance showing up in the emergency room where their breast cancer has broken through the skin and is starting to ooze, and that's when they show up. And by that point, it is also in 5 other organs, and this person has 6 months to live. And then even they're told, sorry, we can do emergency surgery perhaps on this tumor, but the chemo, that's $100,000 a year. You're going to have health insurance for that. This hospital will not provide it to you. In fact, my wife, who had breast cancer 2 years ago, and went through chemo, was sitting in the doctor's office when a guy came in who was poor and didn't have insurance, asking for chemo, and was turned away right in front of her. Are you telling me that that's a moral system?
Well, no. But, I mean, what
shouldn't that guy have had access? I mean, this was before Obamacare. Shouldn't that guy have had access to
Medicaid? Do you think expanding Medicaid is really going to solve that problem?
It does.
I doubt it is.
It does.
It does not.
There are people right now who are getting chemo because of Medicaid. You can't say that they're not.
Well, I can certainly say that if you're on Medicaid, you're
it's a less than perfect system. I'll give you that, but it's something.
Well, why expand, a bad program when there are other ways, to go about this?
Because no other alternative has been offered by the Republican Party, and they control the House of Representatives and they control the Senate with a filibuster.
There's actually quite a few plans out there by Republicans that are alternatives to Obamacare.
The only one that I've seen is Health Savings Plan. You set aside up to $5,000 a year out of your paycheck.
I've also seen refundable tax credits, which can be used to purchase health care and health insurance.
Right, which and everybody's making so much money that a refundable tax credit is going to, okay. David, thanks for dropping by. It's good talking to you.
Sure.
David Hogberg, his website is nationalcenter.org. We will be right back.